So welcome to MLT case study series 8. So in this case study we'll discuss about the diagnosis of malaria, especially the Plasmodium falciparum. We will deep dive into the symptoms, tests and interpretations. So a quick background on malaria. Malaria is a life-threatening disease caused by parasites that are transmitted to people through the bites of infected female Anopheles mosquito. It is prevalent in tropical and subtropical regions of the world, including parts of sub-Saharan Africa, Asia, and Latin America. There are four main types of malaria parasites that include Plasmodium falciparum, P. vivax, P. ovale, and P. malaria, with P. falciparum being the most deadliest parasite. So a quick background on what is malaria. So what happens in malaria life cycle means we have blood vessel, and in blood vessel we know there are red blood cells. So what happens now is once the in this story we have a liver. So these are the three important candidates in this cycle that include blood vessel, red blood cells, liver, and of course the Anopheles mosquito. So once the infected Anopheles mosquito biting a blood vessel, it will release the sporozoites into the circulation. Now these sporozoites will migrate into the liver. Inside the liver, these sporozoites will be converted to Sijont. So this Sijont, upon maturation, this Sijont will be broke, okay, it will be ruptured, and this ruptured Sijont will release merozoites. These merozoites, okay, so the number of these merozoites will differ from species to species. For example, in case of malaria, falciparum vivax, Plasmodium falciparum vivax, they are 20,000 to 50,000 and their time is 8 days. Whereas falciparum is 20 to 50,000 for 6 days. Whereas Plasmodium malaria is 20 to 50,000 and their time is 13 to 16 days. And ovale is 20 to 50,000 merozoites will be released per Sijont within a matter of 9 days. So upon release of these merozoites will be migrated into the red blood cells. They will migrate into red blood cell. Now inside the red blood cell they will start again erythropoietic zygogony. Okay, so here the merozoites will be converted to tropozoites and these tropozoites will be converted to zygonts again. These zygonts will be ruptured and they will release merozoites again. So this is the second time merozoites has been released in the circulation. Now some of these merozoites will be converted to macrogametocyte and microgametocyte. These are the equivalent to sex cells. So microgametocyte is a male cell whereas macrogametocyte is a female cell. Okay, now this merozoites released into the blood, okay, ruptured zygones, then macrocyte and microgametocyte. Now a non-infectious malarial mosquito biting a patient, biting an infected patient, this macro and microgametocytes will release into the mosquito. They will be released into the mosquito. Okay, now the mosquito life cycle will be started in the mosquito. So let's see what happens in the mosquito. Now along with merozoites, the infected merozoites along with macrocyte and microcytes, they will undergo the sexual transformation within the mosquito and they will be matured in the mosquito saliva or buccal cavity or salivary glands and they will again release these merozoites and again the life cycle will continue. These sporozoites will be released into the circulation, they will go to the liver and liver to Sijont released merozoites and again into red blood cells. So this is the complete life cycle of malaria. Now let us see our case study. So the basic symptoms of the malaria include severe to mild fever, headaches, nausea, vomiting, chills, muscle pain, fatigue, coughing and diarrhea. Severe malaria can lead to complications such as cerebral malaria, severe anemia, decrease in blood sugar values, pulmonary edema and even acute renal failure can be seen in severe malarial complications. So the diagnosis of malaria typically involves laboratory tests because symptoms can be non-specific. The main diagnostic test is microscopic examination. During various stages of malaria, in ring stage, trophocyte, Sijont and gametocyte, they will have their own typical morphological characteristics. of various species, falciparum, vivax, oval, and malaria. So based on identifying these morphological characteristics in a peripheral blood smear, we can able to identify the type of malaria infection happened to the patient. Then rapid diagnostic tests. The rapid diagnostic test is a card test where we will detect various antigens of falciparum, vivax, malaria, and oval. So PVPF, here there is a PVPF rapid card test. Apart from rapid card test, we can also perform molecular test to determine the genetics of the malarial parasite. What type of parasite infected the patient? That can be detected by PCR. Then study, a 35-year-old male presents to the emergency department with a 3-day history of fever, chills, and severe headaches and nausea. The patient recently returned from the 2-week trip to a malaria endemic area in sub-Saharan Africa. He mentions he has inconsistent with his malarial prophylaxis during the trip. That means he is not taking his malarial drugs during the vacation. Clinical assessments, diagnostic approach. So initial assessment focused on patient history, including travel history to endemic areas and symptoms consistent with malaria. So the lab test ordered include blood smears and rapid diagnostic test has been ordered, and we came to know that we performed a thick and thin smear. So the thick smear came positive for Plasmodium falciparum with high parasite level, whereas a thin smear showed confirmed the presence of P. falciparum. The smear showed multiple ring forms and gametocytes characteristics of falciparum. So in malaria falciparum, multiple rings has been seen in the red blood cells, and that indicates a positive for falciparum. And rapid diagnostic test also came positive for P. falciparum, specific antigens, and diagnosis, the patient was diagnosed with P. falciparum malaria based on clinical presentational lab findings. So interpretation of results, the presence of P. falciparum in the blood smears along with other patient symptoms and travel history confirm the diagnosis of malaria. The high parasitemia level indicate a severe infection which is consistent with the severity of the patient's symptoms. The positive RDT corroborate the microscopic findings and provide a rapid confirmation of the infection. So educational takeaways to medical lab technologies. So importance of rapid diagnosis. Quick and accurate diagnosis of malaria is crucial for effective treatment, especially for P. falciparum infections, which can rapidly progress to severe disease and death. Role of blood smears. Understanding the preparation, staining, and examination of blood smears is essential for the detection and identification of malarial parasites. Interpretation of rapid diagnostic tests. While rapid diagnostic tests provide a rapid means of diagnosis, they must be used in conjunction with microscopy for confirmation and species identification, particularly in areas with multiple circulation Plasmodium species. Continuous education. Staying informed about the latest diagnostic techniques and guidelines is vital for laboratory professionals involved in the diagnosis of malaria and other infectious diseases. Thank you so much.